Hi, I'm Dr. Basma Faris with Girl Mantra. I'm an OBGYN and certified culinary medicine specialist. Today, I want to talk to you about inflammation. Now, acute inflammation is an important part of our body's immune system. When confronted with an infection or if we injure ourselves, acute inflammation is an efficient and critical first step to repair our tissues or fight the disease. But really what I want to talk about today is chronic inflammation, because chronic inflammation is dysfunctional and it leads to disease. It can lead to cardiovascular disease, metabolic diseases like insulin resistant, PCOS, and some cancers. And basically what it is different environmental toxins or dietary components can result in a sustained release of our body's inflammatory chemicals, which are called cytokines and inflammatory prostaglandins, and an inadequate response of our anti-inflammatory prostaglandins. Additives in food and certain foods can either promote inflammation or be anti-inflammatory. So we're going to talk about those today. So again, environmental exposures like chemicals or radiation or toxic substances like smoking can promote inflammation. But certain foods, like foods that contain nitrites, these are usually processed meats, foods that contain trans fats, foods that contain a lot of omega-6, so having too much omega-6 fatty acids and not enough omega-3 fatty acids in our diets can result in inflammation. Too much sugar can also result in inflammation. And just every day when we burn calories, our mitochondria undergoes a process called oxidation, and excessive oxidation can also cause inflammation, so just eating too much. And then other foods are going to be anti-inflammatory. So foods that have antioxidants like vitamin C, vitamin E, vitamin A, and all of the phytochemicals are important to combat chronic inflammation. So if you want to avoid some of these chronic illnesses and reduce your body's chronic inflammation, what should you do? You should A, avoid toxic substances, B, avoid processed meats, try to get more omega-3s in the diet, and those come from fatty fish and certain nuts, especially walnuts, flax seeds. You want to avoid eating too much sugar. You want to avoid trans fats, which thankfully have been banned in the United States and in the European Union, but they can still be found in certain parts of the world. And then you want to increase your intake of anti-inflammatory foods. So that's going to be all of your plant foods, fruits, vegetables, whole grains, legumes, and nuts. So again, decrease your amount of pro-inflammatory foods, increase your intake of antioxidants and anti-inflammatory foods, and that should help to improve your risk of all of these different diseases. And if you have any of these conditions, it will also help as part of your other treatment plan to improve your disease process. So I hope that was helpful. Please stay tuned to Girl Mantra for other helpful nutrition and health information by me and our other experts. See you soon.